Okay. Foam in. Hello, my name is Mariana. I'm going to be your nurse today.
Hi.
When we close the curtain for patient privacy, can you confirm your name and date of birth for me?
Sky Malloy, 9/20/85,
Alright, and do you know where you are right now?
at the doctor's office.
And do you know why?
Getting a physical today.
Okay, awesome. And do you know what year it is?
2019.
Yes. And do you know what time of day it is?
It's afternoon.
Alright, and can you rate your pain level from 0 to 10, 0 being no pain and 10 being the worst pain you've ever felt?
0 pain.
Okay, awesome. So we're just going to be doing your head to toe assessment. That's just a general inspection, making sure everything's good, all good. So I'm just going to be touching your body, different parts, just to make sure everything's good.
Okay, great.
Okay, I'm going to start at your head. Alright, assessing the skin color. Skin is good for ethnicity. Looking at the head. Alright, the arms. Okay, respiratory effort. Okay, and then patient's mood is good. They seem to be okay. Their posture is good. They don't seem to be in any pain. There's no abnormal odor, so everything's within normal limits. Okay, and I have measured the patient's height, weight, and BMI, and the vital signs have been taken. The patient has good within normal limits, no abnormal pulse, temperature, blood pressure, oxygen saturation. The patient's on room air, doesn't seem to be having any respiratory distress, and everything is all good. So I will now be moving into the inspection closer into the face. Okay, Miss Sky, I'm going to be inspecting your eyes now. I'm going to be touching and pulling your eyelids, or your underneath your eye. Alright, inspecting it. Everything looks good. Okay, and if you can look straight forward for me, and then I'm just going to shine this light in your eye.
Okay.
Alright, pupils are, let's see, they're about 5 millimeters. So the patient is perla, pupils are equal, round, reactive to light, and accommodating with a consensual response. Okay, so now I'm going to be examining the ears. This is my otoscope. Just a tone. Okay. So first I'm going to be touching the ear. Do you feel any tenderness, Sky?
No.
Okay, how about back here?
Nope.
Okay, and then anything here?
Nope.
Checking the mastoid process underneath. Anything here?
Nope.
Alright, now I'm just going to be looking in your ear. Okay, pulling it up and back and sticking the ostoscope halfway in the ear and checking the tympanic membrane, and I see no buildup of cerumen and no inflammation. That's good. I'm pulling it up and back, checking the same for this side. Alright, everything is good, no abnormalities. And now I'm going to be doing the nose. Okay, so I'm going to shine this light into your nose. Alright, the nostrils and nasal mucosa is pink. There is dry, there's no inflammation, no drainage, so it is all good. Can you breathe through your nose for me, Sky? Awesome, awesome. Well, I'll now be doing the whisper test just to assess your hearing, so just let me know when you hear me say something.
I heard it. Yeah. I got you. I heard it.
Awesome.
Yes.
Okay, so now we're going to be evaluating your sinuses. Just going to be feeling on your face. Let me know if you feel any tenderness. Alright, and then while I'm feeling, I'm going to check to see if I feel any lymph nodes. Usually you don't want to feel any lymph nodes unless you're like fighting off something. Okay. All good. Then let me see the trachea. The trachea is within the midline. Alright, and then you can open your mouth for me. I'm just going to be shining this light in there. Awesome, awesome. Okay, can you say ah? Alright, I see that the uvula rises. All teeth are intact. I'm going to be pulling down to check your gums. yeah, see no inflammation, everything's good. I see no white lesions, nothing like that, so it is all good. And then I'm now going to be, let me double check the tonsils. Okay, I don't see any white patches or anything like that. Okay, so then let me feel the carotid artery. Okay, yeah, they're equal and good. Okay, then I'm going to be feeling your wrists and your arms.
Okay.
Okay, they're equal. They're strong, but not bounding. Okay, awesome. So now I'm just going to be listening to your chest for your respirations. And I'm going to start by listening, and then I'll be touching them and listening to it.
Okay.
And then usually I would do this skin to skin, but for this video I'll be doing it over the clothes. And then if you could just take in a deep breath for me every time I move my stethoscope.
Okay.
Oh, sorry. Take your time. Alright, and then I'm going to be doing the same for the back.
Sorry.
Alright, and then I'm just going to be putting my hands here, and then if you take in a deep breath. Alright, good. So, I didn't hear anything like any crackles, which would be like the wet popping sound, also called rails, that would happen whenever there's an increased amount of the alveoli snapping whenever you're inspirating. Didn't hear any of that. I didn't hear any wheezing, which would be a constricted airway due to inflammation. Every time they would breathe, it would be hard for the air to come in and out of it. So then I didn't also hear any stridor, which would be a high-pitched crowing sound, which would happen during choking or anything like that. None of that, or like a blockage. And then I didn't hear any rhonchi, which would be essentially like snoring, and it would be more of a low-pitched sound. Okay. So we're all good assessing the breathing and the respiration, and now I will be checking your heart rate. So I'll be inspecting the chest. I'll be using 8-man to do this. That's going to be the aortic. Okay. Pulmonary.
I don't know if she can see anything.
Okay.
There we go. You're good.
Aortic. Herbs point. Or pulmonic. Herbs point. And then tricuspid. And then locating the apical, I'll go down the sternum and then find the 5th intercostal. And then I'll listen to a full 60 seconds when checking the apical pulse. Alright, everything sounds good. Okay, so do you have any chest pain or difficulty breathing?
No, I do not.
Okay, so if the patient did have any difficulty breathing, such as wheezing, stridor, rhonchi, I would have them cough and then I would reassess, sometimes to clear it up. So now I'm going to be assessing the back and spine. Okay, Miss Sky, can you stand up and bend over for me? Okay, so I'm checking the spine, I'm checking the cervical, making sure it's the proper curvature, thoracic, lumbar. Okay, all good. If I was checking for scoliosis, I would also be checking the hips to make sure that they are equal. Okay, you can sit down, back down for me.
Okay.
So also for the other two, like lordosis, it would be the sway back, so that would be the outward, like excessive outward curvature, and then the hunch, or then the kyphosis would be like the hunchback, so that'd be an excessive outward curvature, and then scoliosis is a sideway curvature, and so that's why I was making sure to check on the hips, including the top part. Okay. And then, so now I'm going to be assessing the skin trigger. I'm going to be pinching right here. Okay. So it retracted right away, so that means she has no dehydration. Everything looks good. Okay. Now cap refill. Alright. It goes back in less than 3 seconds, which is good. And there's no clubbing. Alright, I'm going to check your toes. Also good. Okay, so then right now I'm going to be defining a couple words for abuse or just any kind of like bruising or anything like that. So like ecchymosis, that's bruising, and then petechiae is tiny circles like underneath the skin that they're not raised, but they still are from broken blood vessels. So yeah. Then erythemia, which is reddening, or like usually comes in patches, and that's from irritation. And then it's the dilated capillaries. And then there's jaundice, which is the yellowing of the skin and the eyes, and that's usually from like liver problems or like the increase of bilirubin. Okay, and then decubitus is the vascular ulcer problem. So that's like pressure ulcers, or like people call it bed sores. So that's the open wound that would be on the patient, and usually that's like on like where they're constantly laying down, haven't been moved. So like some signs of like abuse would be like any bruising, like such as like if it was like a hand print that was a bruise, or anything like that, just like that, but like as a bruise, and or just any kind of injury that like proves like or shows abuse or neglect. You want to constantly be checking for that during your inspection. So now I'm going to be checking the abdomen. I'm going to start by, yeah.
Sorry.
Or let's have you lay down for this part. Okay.
Your bed is high.
Sorry.
Okay.
Okay, so now I'm going to be looking at it from multiple angles, making sure it is symmetrical, that there's no like obvious problems that I can see. And I'm going to start by just listening to it, and then I'll be palpating it. So right now I'm going to start at the right lower quadrant, and then just work my way around and listen to each quadrant to make sure that I can hear any bowel movements and see if I hear anything that might be concerning or anything like that. Okay, Miss Guy, I'm going to be listening to your abdomen now. Right. Right over. Okay. And when was your last bowel movement, Miss Sky?
It was yesterday.
Okay. And when was your last menstrual cycle?
I actually had a period last in 2010 because I had a uterine ablation, so I don't get them anymore.
Okay, good to know. And do you have any problems urinating?
Not at all.
Okay, I'm just gonna palpate your abdomen now to check for any tenderness. So let me know if you feel any pain. It is nice and soft. Everything feels good. All right. And then during the auscultation, if I didn't hear anything, I would check for a total of 5 minutes and then either reassess, get another nurse, anything like that. So I checked, and I didn't see any umbilicus herniations or anything like that. It was all good. And after this, I would inspect the perineal area and just make sure that there's no like odor or like excessive like discharge or anything like that. Okay, Miss Sky, we can have you sit back up, and I'm gonna have you sit back in the chair, and I'll be checking your bag for your kidneys. Using the CVAT, so I put my hand and then I pressed it. And do you feel any pain when I do this?
Nope.
Okay, awesome. All right, and then now I'm just gonna be checking your pulses farther down. So, okay, let's see.
There you go.
Okay, so then there's the femoral pulse, and then there's the popliteal pulse, which is right back here, checking for equalness. Okay, then there's the post-tibial pulse, and then there's the pedial pulse. All right, and then for the Holman sign, I would have her put her leg out and put it up, and then down. Okay, and then the other one. Okay, everything is good here. For the pedial pulse, it was good in bounding or like normal strength, and it would be like a 2+ for it, I think. Yeah.
Yes.
Okay. Then now I'm going to be checking for edema, and if it was pitting, it would go into the skin, but it is not in. Okay, so for edema, there's ankle and foot pitting, but there's nothing here. So she's non-pitting, since whenever I push down, there's nothing that stays down. So pitting, like there's different numbers for it. There's like the 1+, which would be 2 millimeters deep, and then there's a 2+, which would be 4 millimeters deep. Then there's a 3+, that's 6 millimeters deep, and then the 4+, which is 8 millimeters deep. So there's none of that going on. So now I'm going to be checking her musculoskeletal parts, the movement and strength. Okay, so
I smile weird.
okay, so now I'm just gonna test her walking and all of that.
Okay.
Okay, just walk a couple steps for me. All right, awesome. And then I'm gonna be doing the Romberg test, so you just stand right there and close your eyes for me. Okay, you can sit back down for me, thank you. Okay, now I'm just going to be fully assessing her muscle strength and all of that. Can you squeeze my hands? Can you push up, push down? Alright. Can you flex for me? Oh, yeah. Okay, then I'm checking for hair distribution. Everything looks good. Push down for me. Push up. Alright, okay, that's all good. What else is there? And then temperature is good. She doesn't feel too cold or too hot. All hair distribution's good. You can feel whenever I'm doing this, correct?
Yes.
You feel this?
Yes.
Okay. She feels everything.
Yes.
There's no abnormalities going on. She's perfectly healthy human being. Then checked the grip strength. It was all good. That there was nothing going on with that. And yeah, so we're all done here, Miss Sky. Is there anything else I can do for you before I go?
No, that's it. Thank you so much.
Okay, and if she was in a bed, I'd make sure 3 bed rolls were up, her head was in a comfortable position, or doctor's orders. And I'd make sure her call light was within reach, and I would make sure when I leave, I would provide patient privacy, and I would foam out, and yeah, that is it. Thank you.